What psychiatric medications are most commonly used to treat insomnia? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist. And while I typically would start with lifestyle changes and maybe some supplements to help with insomnia, there certainly are cases where prescribed pharmaceuticals can be helpful. So this is going to be part one because there are a lot of medications that can be used for insomnia. Probably the first line medication is going to be hydroxyzine, which is a first generation antihistamine, similar to Benadryl. So the effects are similar to Benadryl, meaning that it can cause things like drowsiness, dry mouth, dry eye, sedation, dizziness. And I find that it either causes people to feel super sedated or it's like a sugar pill and it doesn't affect them at all. We do have growing evidence to show that there can be some increased risk of developing dementia in people who use first generation antihistamines on a regular basis over time. So I do recommend trying to use this just as needed rather than something that you take for the rest of your life. Another one that you may not have heard of is called Rozarum. So this is a melatonin receptor agonist. So it basically acts like melatonin in that it is stimulating your melatonin receptors, which should help to stimulate those natural circadian rhythms. So you're going to take it about an hour before you would want to go to sleep with the hope that it would help boost that natural melatonin escalation that happens before sleep to help you to feel sleepy and trigger that normal rhythm. It does bind a little more strongly than melatonin, so it may be a little bit stronger than just taking melatonin. And so for this reason, there can be a little bit more risk of feeling drowsy the next day. Number 3 is going to be the Z drugs. So these are medications like Lunesta, Ambien, and they're going to act on the GABA system just like benzodiazepines, which is what I'm going to talk about next. But they're supposed to be more selective and less likely to cause things like tolerance, withdrawal, dependence, significant drowsiness, coordination issues, etc. However, in practice, they can pretty much cause all these things, and they do also have the risk of complex sleep disorders, so things like sleepwalking, sleep eating, sleep driving, and in severe cases, they can cause psychotic symptoms. So these aren't medications I use first line, but certainly other providers, especially in primary care, do, but I do think there are some better options. And then the last one I'm going to talk about in this video is going to be benzodiazepines. So these are some of our most powerful medications for both anxiety and insomnia, but at the same time, that makes them one of the most risky because of risks of things like dependence, tolerance, withdrawal, sedation, falls, cognitive issues, all the things. So there are a number of different benzodiazepines that are used for this purpose, sometimes clonazepam, temazepam, lorazepam, alprazolam, diazepam, and they vary by their duration of action and how quickly the effect comes on and off. Again, for similar reasons to the Z drugs, these are not medications that I would use first line for insomnia. However, I definitely have inherited many patients who have been on them long term. If there's any of these that you want to hear about in more detail, then let me know in the comments below. Or if you've had an experience with them and you want to share in the comments, feel free to do so as well. If you're interested in getting more direct resources and content from myself, I do have an email list and I send out bi-weekly emails. So if that's you, then send me a DM with your email and I'll see you in the next one.